Friday, April 1st, and it's time for another legislative briefing from the North Carolina Medical Society. It's April Fool's Day, and I'd love to tell you that the political discourse around our nation has all been a big joke and just a big crazy thing, and it's all going to be over. But unfortunately, I can't. But one thing I can report to you today is that we've had a great conversation started between doctors and community leaders about Medicaid reform. And those have been here in Raleigh and down in Mecklenburg County over the last couple of days as DHHS has started their listening session on the Medicaid waiver proposal. We've had family physicians, we've had pediatricians, we've had psychiatrists all attend these meetings and express their opinions and express their beliefs and aspirations about where Medicaid should be going in the future. And we really appreciate those doctors that have been able to participate. This next week, we move out west. We go to Sylva and Boone and Asheville for that same listening tour to continue and for you to have an opportunity to stand up and talk to leaders within DHHS and express your feelings about how you think Medicaid should be transformed in the future. So we hope that you will look to our talking points that we've put online as guidance. We hope that you will take your personal experience and you'll show up to those meetings and have a pleasant conversation with the Department of Health and Human Services and give them some guidance on how to go forward. In regards to continuing to talk with legislators, I'd love to give you just a couple of pieces of advice. First thing is we all react at times with language that we wouldn't want to be said to us in different ways. And so realizing that legislators are the folks that will always be there, the folks that we have to partner with on a regular basis to have conversations, I would encourage you to be sure that you express your opinions, but also leave room to continue to work with them in the future. It's always easy to jump out and say something just off the tongue, but realize that these are long-term relationships that we're asking you to develop, we're asking you to foster, and we're asking you to preserve. And to that extent, we'd love to encourage you to continue to reach out to legislators and ask them to come to your practices and see what you're doing with your patients in your practices. Help them understand what's going on with the daily practice of taking care of patients and what it takes for you to continue to take care of patients on a daily basis so that they have that understanding when they come to Raleigh to make decisions on your behalf. We'd also encourage you to start thinking about the legislative session that's coming up on April 25th. Think about being a doctor of the day and seeing the perspective that they have of what's going on down here in Raleigh, the decision making and the pressures that they're under when they're making decisions down here by coming down and being doctor of the day for the legislature for a day, or participating in a White Coat Wednesday where you come down and spend some time with us advocating on behalf of organized medicine. But no matter which way you communicate, we hope that you will continue to reach out to them, continue to give your perspective on what is needed and what is best for your patients in a way that they can use that information to make good decisions for the state of North Carolina. I hope this is helpful, and we look forward to continuing the conversation in the weeks ahead. Have a great week.